We now have Abubakar Halidu from Nigeria. Could you please, Abubakar, are you there?
Yes, I'm there.
Please go ahead with your question.
Well, is there any country that now you get an information about specific meditation for this COVID-19? And secondly, we need an exact figures of affected peoples in Nigeria. Thank you.
Sorry, could you repeat that question? We lost you a little bit. Your second part of the question wasn't clear.
Okay, I said we need the exact figures of cases in Nigeria that you have.
So I think your question was about medication. Is there any medication that works, and what are the issues with cases in Nigeria?
So thank you for these two questions. With regards to medication, as the Director General outlined in his speech today, currently there are no specific medications that have been approved for COVID-19. However, there are a number of clinical trials that are ongoing, and there's the Solidarity trial that is currently starting, which is just enrolling patients now, which is looking at therapeutics in a clinical trial. And what is very important is that these medications are evaluated appropriately so we know what works and that we have the right data to support what works. With regards to the numbers of cases in Nigeria, we have seen, I don't know the exact number, if you have...
46.
46. Do you want to take that one, Mike?
Yeah, the number of cases in Nigeria remain quite low, despite Nigeria having a reasonable capacity to detect those viruses, but the risks are nonetheless there. And we see disease now, COVID-19, in almost every country in Africa at this stage. So the risks are certainly rising, but the numbers are still low. And again, we need to ensure that we have a very strong public health response on the African continent. We need a response that's built from the community up. We need to try and avoid the worst impacts of lockdowns, slowdowns, shutdowns, so we minimize the necessity of measures like that, which will have a very hard impact on people's lives and livelihoods, from which they may not recover as quickly as people in other countries. We also need to look at the very vulnerable populations we have in Africa, refugees, in some cases, people who are living with HIV, and children with malnourishment. So there are, while Africa is a relatively young continent, and that may be an advantage for Africa right now, there are many, many other vulnerable people in Africa for whom we must provide maximum protection. Africa, again, has demonstrated with polio elimination, it has demonstrated with cholera response, with Ebola response, that African countries have capacity to respond to epidemics, the resilience to live through epidemics, and to recover from them. But what we need to do is bring our communities on board. We need to leverage the power of community-based surveillance. We need to empower and engage with communities, with NGOs, with civil society, with local government, and an all-of-government approach, as Dr. Tedros continues to say. It is even more important in the context of Nigeria and the context of Africa that those approaches be taken. In terms of, I think you said medications, I think it's really important that we say quite plainly right now that there are no proven effective therapies or drugs in the fight against COVID-19. They're the answers we're trying to find. Good supportive care, early admission to hospital for those who are with underlying conditions, who are developing severe disease, Oxygen and the provision of oxygen to people is life-saving, and in certain small number of patients, the ability to ventilate patients in order to get them through the worst of the infection. So we have things that work in terms of clinical management. We do not have effective drugs, and that is why the Solidarity trial is so important, and so many of the other daughter trials around the world are so important to answer these questions.
Thank you, Dr. Ryan.